The importance of breast cancer awareness was very prominent during the Kentucky Oaks. Now, the methods and procedures now to prevent and to treat breast cancer have advanced considerably. With us now is Dr. Audrey Stockwell. She is with KORT Physical Therapy. Dr. Stockwell, thank you for joining us. I appreciate you. I wish you were here in studio, though.
I know. Sorry. Well, I just thought I was able to be here at all. It was. I was glad to be asked back and happy to chat with you today. Again, apologies for not being able to be there live, but happy to talk with you.
Well, I'm glad that you're here. Okay, the name of the program is Strength After Breast Cancer. So yes. What is the mission of this program, and exactly how does it work there, Dr. Stockwell?
Yeah, absolutely. So it is a evidence-based, well, it's more than just strength training, but it's an evidence-based program for individuals that have had breast cancer, either are currently going through treatment or have had it in the past. It's a slowly progressed strength training program that involves aerobic conditioning, strength training, flexibility, and balance training in order to help a bunch of different things, a bunch of different benefits, but primarily it was made to help decrease the risk of developing lymphedema, which is an abnormal swelling that can occur after lymph nodes are removed, and help reduce the risk of worsening or exacerbation of lymphedema.
So if one has breast cancer or if they have a history of breast cancer, why is this program so important?
Yeah, no, absolutely. So there's a lot of new literature that's just come out. Actually, the American Cancer Society just put out their new physical activity and nutrition guidelines for 2022. The last ones were published 10 years ago. The new guidelines have just come out to further reinforce that being physically active, weight management, all of that helps decrease the recurrence of breast cancer in those that have had a diagnosis. So this program helps keep people active, helps manage weight, which so not only helps prevent lymphedema onset, but it also helps reduce and recurrence of breast cancer, which is huge. One of the studies that have been going along with this program show that in women that have had 5 or more lymph nodes removed, that participating in this program can actually reduce the onset of developing lymphedema by 70%. So that's huge. So a lot of benefits with this program, lymphedema reduction, but also just overall improved health and quality of life and decreased breast cancer recurrence.
Yeah, I love that it's research-based, that it's all about, improved outcomes. This sounds very exciting. So for a patient or someone with a history of breast cancer, what is the commitment of this program?
Yeah, absolutely. So it's a 4 to 6 session program. Starts out with an individualized one-on-one initial evaluation where we go through health history, risk factors, screen for any types of existing lymphedema or swelling, any kind of shoulder mobility issues that may impede somebody from participating in the program right away. And we meet with you, talk about your individual goals for exercise activity and any barriers that may be there to help overcome. So that's a one-on-one appointment. We also go over a lot of education. And then after that, it's twice a week, not always twice a week in the clinic. So it might just be once a week in the clinic, and then you commit to doing 1 day a week of the exercise program at home. And it's, again, 4 to 6 sessions overall, about 4 to 6 weeks.
This is very exciting news, Dr. Stockwell. So if someone is watching now and maybe they have a loved one who has breast cancer or a history of breast cancer, how do they get started with this program?
Yeah, so they can get started. They can contact us with our phone number. You don't have to have a doctor's order necessarily. It is covered by insurance, so insurance actually does cover the program. But they can go to our website, KORT.com, or they can call us at 1-800-645-KORT or 1-800-645-5678. And we can get started. And again, we'll contact the doctor if needed, but most times it's no order needed. Insurance does cover the program.
So if someone is leery, though, of traveling a little bit or meeting with people one-on-one due to the COVID variants that now exist, can they do this via telehealth? I think they call it telehealth. Is that right?
Yeah, telehealth. Yeah, we call it telehealth, tele-rehab in our world. Yes, absolutely. So this is actually a great setup for telerehab. In an ideal situation, we'd like to see that person for their one-on-one session in person if possible. And we do those in private treatment rooms. We have, full safety with masks, PPE, everything. We've done all our, testing and all of that. But if possible, just because we can get better outcomes if we can test you on some things in person. But if not, we can still do it remote. If transportation is a barrier, and or if immunocompromised or worried about COVID variant. But from that point on, absolutely, this is a great program carried out at home. We're there to help support you with your goals and can do it via telerehab.
What if someone, Dr. Stockwell, is interested in this program, but they're currently going through chemotherapy or radiation? Can they still join the program?
Absolutely. So one of the benefits of this program is that this can help you while you're going through treatment, keep your energy up, keep your activity levels up. One of the biggest side effects of going through chemotherapy or radiation is cancer-related fatigue, weakness, deconditioning, and this can help combat that. So we can do this program while you're actively going through treatment, and it will help you be able to overcome these side effects and stay on your treatment better and longer. We will be in consult with your physician to make sure that we're doing this safely, and we will make sure we watch your vitals and your blood counts and all of that to make sure that we're progressing at an appropriate pace.
So you mentioned that insurance covers this. Does a patient or someone interested in the program, do they need a doctor's order to join the program?
So not necessarily. If we do need a doctor's order, so some insurance plans in order to cover it do need one, we are happy to reach out to the physician for you. So once you contact us, if you're interested in the program, we can reach out to your doctor and get that order signed if we need it.
Once again, it's called Strength After Breast Cancer. Dr. Stockwell, thank you so much for your expertise and time. This is, for you as a doctor, this has to be very exciting because you're getting more positive outcomes, right?
Absolutely. The individuals that we have go through this program have nothing but positive things to say about it. It's really given them their life back. They've been able to get back to their former selves and sometimes better, right? It's a lot of times when people are diagnosed with cancer, it's a perfect time to make a lifestyle change. And a lot of folks are honestly very motivated at this point to, as they're going through treatment, to stay active, stay improved. And then years after treatment, like I said, it helps, very evidence-based, help reduce recurrence, but just to get your life back and be in control of something that you can control. So it's very rewarding to work with these patients.
A very positive message, Dr. Stockwell. Thank you so much. Again, KORT Physical Therapy. If you're interested in the program, give them a call today. We'll take a little break, and then